Now we're getting somewhere. Let's look at another actual preceptor with another actual resident doing another actual video review.
Doctor, I hear about my back. It's really sore, lower back and in my leg, going down my leg.
That's too bad.
But my leg, you know, it hurts, and my back. Oh, but the pain, like you can't believe
pain.
Yeah,
a lot of pain.
I tried Tylenol, and it's not working. So I got an appointment with you.
Have you seen?
Well, I think that's really neat. But
I got a new app.
Is there an app there on back pain? Like
No, but it's Angry Birds.
Oh, I see. Oh, yeah, right, yeah.
Okay, so what were you planning to do with this guy in terms of his back pain?
Well, I've seen a few of these patients in the last week or so. Just sounded like run-of-the-mill, typical lower back pain. It's probably going to throw them up on the table. Straight leg raise test and probably some painkillers to go.
So how do you know that he doesn't have something else more serious, like an aortic dissection or an aneurysm or cancer or kidney stones or something like that?
Guess I kind of missed those. I don't know. It just sounded like typical lower back pain.
What would you like to do if you had to do it over again?
I probably should take a full history, a thorough physical exam.
Okay, that would be a good idea. And what was distracting you, do you think, during this interview?
Maybe the iPhone?
Probably.
Oh, this is so much fun. Oh, there was a lot going on in that one. I wasn't paying much attention. I wonder what Leslie has to say. Leslie?
So this scenario raises another common pitfall, and that is avoiding professionalism issues. I know it's easy as a preceptor to talk about history taking and clinical exam and shy away from any issue that we think is unprofessional. But remember, your learners are not going to get that information anywhere else. They're going to learn how to be professionals in the clinical setting. So what you need to do is label the behavior that you think is a problem, like not paying attention to the patient, attending to your smartphone instead of interviewing the patient, and then you need to discuss what are the consequences of that behavior. Decreased patient-doctor rapport. The patient may not be compliant because he doesn't believe in your advice because you weren't listening to him. In fact, he may not even come back to see you again. So we need to focus our feedback on the professional issue at hand.
You're right. It's said that recognizing lapses of professionalism is a lot like watching pornography. It's easy to recognize, but not always easy to discuss. Let's take a look. We're going to keep this film G-rated. Professionalism is challenging to teach. It is best taught during the clinical encounter, especially using video review. On that note, the CanMeds Framework can be a helpful way to approach video review, remembering, oh thanks, or in my case, reading from the script. The CanMeds Framework is a guide to the essential abilities physicians need for optimal patient outcomes. This framework of core competencies are organized around 7 key physician roles: medical expert, communicator, collaborator, manager, health advocate, scholar, and professional. Maybe I should memorize that. Anyways, these roles can act as a guide when doing video review. One can ask if a learner is demonstrating good communication skills, medical expertise, or professionalism. Please excuse me, I have to resume my scholarly activity. Man, those birds are angry.